Hello. It's quite possible that as you sit there, some of you may have parasitic worms living inside of you. Terrifying as it may seem, pinworms, scientifically known as Anaerobius vermicularis, are the single most common parasite found in humans, and the scariest part is you may not even know it. I intend to tell you everything you need to know about this common terror, how it lives inside of you, how you can tell if you have it, and how to be rid of it once and for all. So buckle your seatbelts and prepare to listen to the grossest and most important thing you may learn all day. Ladies and gentlemen, enter the pinworm. I consulted the Center for Disease Control to find out how we get pinworms. According to their website, self-infection occurs by transferring infective eggs to the mouth with hands that have scratched the perianal region. Following ingestion of infective eggs, the larvae hatch in the small intestine and the adults establish themselves in the colon. The time interval from ingestion of infective eggs to oviposition by the adult is about 1 month. The lifespan of the adult is about 2 months. Then the females migrate in the middle of the night outside the anus and lay eggs on your perianal rectum. The larvae contained inside these eggs develop. The eggs become infective in 4 to 6 hours under optimal conditions. Ew. As you can see, a person can reinfect themselves over and over by scratching their backside in their sleep and unknowingly bringing their hands to their mouth. Gross, but knowledge is power, right? The good news is the vicious cycle can be stopped. But how do we do that? We have identified these little worms, but what are the signs and symptoms? First, have you ever noticed yourself itching your tushy a little bit too often? You don't have to answer this question out loud. In fact, please don't. But if you find your backside to itch more than your left and or right side, you may have pinworms. The National Institute of Health has published a list of symptoms that may indicate that you have pinworms. After reading this, if you can relate to this list, a doctor consultation might be in the works. Alrighty, here goes. Difficulty sleeping due to the itching that occurs during the night. Intense itching around the anus. Irritability due to itching and interrupted sleep. Irritated or infected skin around the anus from constant scratching. Irritation or discomfort of the vagina in young girls if an adult worm enters the vagina rather than the anus. Loss of appetite and weight. Uncommon, but it can occur in severe infections. Are you feeling itching right now? Ooh. I know this all sounds terribly uncomfortable and rather scary, but know that there is a sure way to get rid of these pesky parasites. Here's how a doctor would rid you of the worms and how you can stay free from them through the use of proper hygiene. The easiest way to guarantee freedom from infection are to follow a few steps as listed in kidshealth.org and the NIH website. To control the eggs, clean toilet seats daily. Keep fingernails short and clean. Wash all bed linens twice a week. Wash your hands before meals and after using the toilet. Seems so simple, right? Anti-helminth or anti-worm medicines are used to kill the pinworms, not their eggs. Your doctor or nurse will likely recommend one dose of one of 2 different antibiotics that are available over the counter and by prescription. More than one household member is likely to be infected, so the entire household has to be treated. Another dose is usually repeated after 2 weeks to ensure that all the eggs are destroyed. This treats worms that hatch since the first treatment. Avoid scratching the infected area around the anus. By all means, please do not scratch your backside. This can contaminate your fingers and everything else that you touch. Keep your hands and fingers away from your nose and mouth unless they are freshly washed. Be extra careful when family members are being treated for pinworms. By following this protocol of personal hygiene with regards to one's own body and environments, we can minimize the risk of pinworm infection. These scary invaders should seem a whole lot less scary and infection quite a bit more manageable. In conclusion, the terror that you felt less than 5 minutes ago should now have subsided. The pest is very real, but as you know, is nothing to be too worried about. If proper personal hygiene is followed for you and your kids, risk of infection is quite minimal and help is readily available. I hope each of you have faced your fear of these worms and can now make safer choices in your personal hygiene to prevent these parasites from entering your world. Thank you.